I am Dr. Kanene Ubesie, acute care surgeon. I do general surgery, trauma surgery, critical care, and burns and wounds. Out of all of that, I really love trauma surgery. It's so fascinating to me. Out of all those four specialties, subspecialties, trauma is my favorite. I've always felt I belong, right? There was never a time that I told myself I don't belong here. And I take that and extrapolate it to life in general. Any room I step in, anything I step in, regardless if I am an expert or a novice, I always tell myself I belong here. I truly believe God does not place me in rooms that I'm not supposed to be. There have been times where it's been difficult, where other people do not share that same belief. There is a gross number of people that feel that do not belong as a surgeon. And so I've had to deal with that all of my medical training career, and I still deal with it today. That part is what I'm trying to mitigate, but I've always felt that I belonged as a surgeon. When I think of confidence as a surgeon, it's confidence to make someone better, make someone well, making sure that at the end of their surgical journey, they are much better off than when they started with you. And that gives me confidence as a surgeon. That came from, and that was taught to me by my father, who's an OBGYN. Me knowing that I am continuing a legacy also gives me the confidence to be a surgeon. What I'm working on right now is my fitness and wellness career. I got into fitness and wellness back in 2016, very heavy, and I never really left that side. And so right now I'm working on building a wellness center. I'm a marathon runner. The gym is my piece. Outdoor stuff, anything that involves fitness, anything that involves wellness, nutrition, that's me. I think it also kind of helps me take care of my patients and make sure my patients are living a great life as well. A bunch of women surgeons. It's kind of obvious, right? It's in the name. You would be surprised how often you don't find a bunch of women surgeons. Now, that is becoming obsolete. More women are going into surgery. You're seeing more women in the surgeon role. These women surgeons are phenomenal. They have overcome societal norms to even be where they're at. And so they've done great things. And you wouldn't even know it talking to them because they're normal. These are great women inside surgery and outside surgery. They're building families. They are mentoring. They're traveling the world. They are the chairs and the chiefs and the directors of their respective institutions. And they still sit down with you and they talk about yesterday's weather. They talk about the Chanel bag they bought last night, right? They're normal people, yet they're phenomenal in their own right. The women surgeons drew me to AWS, but their character, their openness, their willing to accept you is what kept me. Inclusivity. That's what it means. When I see a diverse organization, a diverse institution, I see a institution that is inclusive. Being inclusive means you absorb different thought patterns. You absorb different opinions. You absorb different genders, different sexualities, different goals, different passions. It's just not something that you can just narrow down to somebody's skin color and nationality. That doesn't work that way. And so I do truly feel that AWS is one of the rare organizations that is diverse in that sense. It goes beyond skin color. It goes beyond gender. Leaving a legacy is leaving knowledge and encouragement behind. I've impacted the minds of younger generations to become a surgeon. I've mentored to younger generations. If I were to do nothing else further today, I've done enough. When I started this trajectory of being a surgeon, one of my goals was to impact just one person. And I've done that many times over. So I think I've already left a legacy. But as I prepare to leave this earth, what I want people to remember is that I became a surgeon with grace. I became a surgeon to help others be well, not just heal from their scars, but heal as a whole person. I became a surgeon to open the possibilities to people that look like me, that think like me, that talk like me, didn't think were going to happen. So I want to leave a legacy of possibility. Inclusive. Grace. Let them. Saving lives. I'm a surgeon.